Okay, good morning, good afternoon, wherever you are. Thank you so much for once again prioritizing your own health and your own well-being in our Be Well Together series. We have a very special guest with us this morning that I am thrilled to be able to have some time with. Today we have Dr. Kim Norman, who is a leading psychiatrist and professor for adolescent and young adult health at UCSF. So Dr. Norman has served as an attending physician at UCSF's Langley Porter Psychiatric Hospital and Clinics for more than 35 years. He also founded the UCSF Young Adult and Family Clinic, which pioneers psychiatry programs for young adults and their families. Most importantly is that he's just a really important member of our Salesforce Ohana. He advises us on mental health. I have had the great pleasure of being able to partner with Dr. Norman for, gosh, maybe almost coming up on 2 years now, I think, something like that. So it's wonderful to have you here today. I'm so thrilled that you can help talk to us about some of the challenges that we're dealing with our children and with our families. So with that, Dr. Norman, thank you. I'm going to turn the call over to you.
Okay, thank you so much for having me, and thank you everybody for joining us with this conversation this morning. The COVID-19 pandemic has given us all the opportunity to spend more time with our families, which at times feels like a great silver lining, and at other times it's really, really challenging. What I want to do today is really focus on ways that we can help our kids. That's going to be the primary focus of the talk this morning, and also say a little bit about coupling. So in thinking about how to help our children during a time of crisis, I'm going to cover the 4 R's. You can tell me if you can see this or if this is more of a distraction, but can you see it? Okay, so the 4 R's we're going to talk about are resiliency stories, reassurance, routine, and regulation of emotion skills. Those are the 4 categories, and we're going to go through each of them. A study I found really, really fascinating came out of looking at kids who'd survived Hurricane Katrina. Remember Katrina in 2005, 160,000 families were displaced. Hundreds of people were killed in the storm and the floods. This particular study I'm referring to looked at children a couple of years later, wanting to look at who was recovered, who seemed to be thriving, who was still struggling with the trauma. And they looked at the kids from the standpoint of family stories. And there are 3 kinds of stories. There were stories of rags to riches. We came to America, we made a fortune. There were stories of riches to rags. We had it all and we lost it in the flood or in the Great Depression. And then there were stories of we came with nothing, we made a lot, we lost it, we made it back again, we lost it again, and we made it back. And lo and behold, the kids that were told the stories of ups and downs, really stories of resiliency, life gives us adversity, we overcome that adversity, those kids did much better. So it's really important to think about the stories you're telling your children now about adversities you faced, about adversities your parents faced or your grandparents faced, and tell these stories. You may have well told them before. Your kids may roll their eyes at you because they've heard them 100 times, but stories of resiliency really help. They really teach kids that in our DNA as we bounce back, and that's really important to communicate. And that segues really well into the second category, which is reassurance, how to reassure our kids. Now, resiliency, reminding them that, we've been through tough times and we get through tough times is very reassuring. In order to be able to reassure, you have to really understand what your child's concerns are. Now, we talk a lot at Salesforce about a beginner's mind, coming in with no preconceptions, no idea of, and certainly no judgment. Another way of saying that is deep listening. We're all ears. We're listening. We're trying to understand what our child's concerns are. Better that we listen rather than anticipate and try to tell them what the concerns are. We may be introducing worries they don't already have. And we don't want to give them more information than they need. We just want to address specific concerns. Now, listening to your child can be challenging. Some children are quite precociously verbal and tell you where their heart's on their sleeves. Most kids are quieter. Some kids, you really have to listen carefully. Now, I remember in 1991 during the the first Gulf War, my then 3-year-old daughter, who's normally quite adventurous and very gregarious, all of a sudden she wouldn't go outside. And I said, Sarah, what is the matter? She wouldn't even go into our backyard. She said, uh, because of the rocks. And I said, the rock? She said, Daddy, there's a bad man under a rock. And I said, sweetheart, not Iraq, Iraq. Iraq is a country, and he's in a country very, very far away, and we're safe. That made her feel better, but we still had to turn over a couple of rocks to be sure. But the point is, I never would have thought, but I don't know how she heard it or what she heard, but how she interpreted it in her 3-year-old way was people are really scared of a bad man in a rock. So we have to try to listen to how our kids might be expressing to us their particular fears. A colleague of mine told me about her 6-year-old son who opened up his toy bin, took out every one of his toys and washed them all down. He was protecting his toys from COVID, and he was protecting himself from the toys, transmitting it to himself. But it was his way of mastering the anxiety, the concerns about the pandemic. We don't expect any parent to be a child therapist, but children do express themselves a lot through their play. So just paying attention, a child, for example, who is quarantining all of her dolls or stuffed animals is playing out her worries or concerns about the pandemic. We understand it as children's way of mastering their fears. They want to play with it, work it out, master it, be on top of it, we work it. Paying attention and asking questions about their play or sitting down and playing with them could be very helpful. Children also sometimes will show their distress by regressing a bit. Sometimes they may need more help, putting their clothes on, even though they'd always done it before on their own. They may be more clingy, they may be more irritable, but these are signs to just kind of chime in and ask how they're feeling, how they're doing. Older kids will be, much more prepared and able to, articulate how they're feeling and what their specific worries are. And there, I think it's really important in offering reassurance to recognize that you have to be the number one most trusted source of the news. Kids are hearing things from friends, and you can ask them, what are you hearing? Or what are you seeing on Instagram? Or what are your particular, concerns that you've seen? And I'll tell you, if your 10-year-old tells you, Mommy, I'm really worried about the impact that falling oil prices are going to have on the global economy, your 10-year-old is very precocious and is watching too much news. But it's really important that you be the one as parents to really kind of filter the news. So we want to focus on the data, and the data is overwhelmingly reassuring that children will not get sick, and if they do, it's going to be very mild. And so we can certainly reassure with facts. We in reassuring too, it's important when a child expresses a fear, not to say you don't have anything to worry about. You do have something to worry about. We all do. School is out. They can't have play dates. They're being told to stay away from grandma and grandpa for a short time so that we don't make them sick. They know something is up and it's big and it's unusual. And yet, if we say, it's a scary time and we will all get through it together. That is very reassuring. I really want to underscore the power of the word and. If we say, yes, you're afraid, but when human beings hear the word but, what usually follows but is something negative or something challenging. If you use the word but, it kind of ends the conversation. Use the word and. I know you're worried, and we're gonna get through this together. The conversation keeps going. So it's really important to keep the conversation going as much as possible as you reassure. So the next category I want to talk about is just routine. We've talked a lot about how as adults working at home, we need to stick to a routine as best we can. And indeed we do. We should get up at the same time. We should exercise like we normally do. We should have meals at structured times. We should try to go to bed at set times. Kids especially love routines. All of your kids, all ages, routines. You don't have to be super rigid, but they should have a regular routine. Remember, for your school age kids, they should be in school. They would be normally in school from 9 till 3. Not a bad idea that between the hours of 9 and 3, they have school assignments to do. Some schools are giving assignments, not all schools, but you can do some homeschooling with your kids. If they normally do reading, at 10 o'clock, give them a reading task. If they normally do math at 1 o'clock, give them some math problems, but give them that kind of structure, and they will thrive just as well as you. Same thing around giving them breaks for recess and for physical activity, and join them in that. We heard yesterday from our COO, Brett Taylor, who plays the guitar, that he set up a school of rock in his house. So after school, after regular school, he's teaching his kids how to play guitar. But think about things like that, ways to engage. Middle school kids in particular, I mean, I'm talking now 11 to 13-year-olds. These are kids that are at a phase where they're starting to master things. They're getting really good at soccer, or really good at music, or really good at art. And they really want to master things. Give them tasks to master. Give them things that they can work on and improve, and give them a routine around it, and join them in it some of the time. And that will help a lot. Okay, the last category I want to talk about is regulating emotions. First and foremost, we as parents have to regulate our own emotions. We need to be calm, and our kids will be calm. If we're anxious, they'll be anxious. If we're agitated, if we're tearful, they will become. We have a saying that a parent can only be as happy as his or her least happy child, and all of us as parents know that to be true. Well, it goes both ways. Children cannot be happy if their parents aren't happy, and so we want to model for them a hopefulness, a calm, and a togetherness, a connectedness. Now, in regulating emotions, Ariana Huffington really gave us some great tips. Look, basically, stress management comes down to 3 things. Number 1, stay in the moment. Try not to be worried about what's going to happen next week or next month or the month after. Don't look back. Don't kick yourself because you didn't have the foresight to sell your stock 2 months ago. Just stay in the moment. There's the line from Eleanor Roosevelt: yesterday's history, tomorrow's a mystery. Be in the moment. It's a gift. That's why we call it the present. But that's a really important. If you're present and you're focused on your children, on yourself, on your work, that immediately calms. The second thing in emotion regulation that Ariana also talked a lot about is focus on what you can control. And what your kids can control is washing their hands, keeping a social distance, doing their work, being helpful. I think a big part of managing emotions is feeling good about who you are and how you act. Think about your core values. Salesforce is a company that talks a lot about values and takes them very seriously. I was fortunate to be one of the members of the audience when Mark interviewed President Obama at Dreamforce last year. And it was beautiful, but what Mark did, he asked President Obama, what are your most important values? And Obama, after thinking for a moment, said, I've always taught my daughters to be kind and to be useful. And what that really resonated with me. I like to think of those as my core values, and that's how I want people to see me. But think of ways to be helpful to other family members. Think of ways of helping with the cooking, helping with the cleaning. What can I do to create a positive tone? And we can use this time. Mark suggested, for example, that every employee go on Trailhead and become rangers. Improve your skills. Take the time to do that. I'm saying take the time to become your best self in other ways. Think about your core values. Ask yourself, am I being true to the person I am or the person I want to be, and be that. And that's leads me to want to talk a little bit about teenagers. Teenagers are at a phase in life where, guess what? They are becoming independent, they're becoming defiant. Sometimes they have feelings of invincibility and they act really dumb, or out of feelings of rebelliousness, they act really dumb. And you've heard about some of the beach parties and other things that teenagers have done. We certainly want to dissuade them of it. I actually, well, let's say one other part about teenagers. Teenagers like to argue. I always remember my same daughter who thought there was a bad man under a rock. When she came home one day from high school, she said, "Mom, my teacher said I should join the debate team because I'm really good at arguing. Did you know that?" My wife said, "You've only been arguing with me since you could talk." But yes, I did know that. But our generation, what kids are doing when they argue with us, they're kind of connecting and distancing at the same time. If I'm arguing with you about a topic, I'm on one side and you're on the other, so I have some independence, but we're connected around that argument and fight. So we want to cut them slack and give them a little bit of room to do that. But we want to appeal to the best part of our teenagers. I got to tell you, I am really hopeful about Generation Zers. Generation Zers are kids born after 1995, so 25-year-olds and younger. This is a generation that I believe is going to go down as the next greatest generation. These are kids who care about social justice. They care about equality. They want to save the planet. They want to make the world a better place, and they're highly creative. They like to create memes. They like to do TikTok videos. They're highly creative. And they like to give back. So employing your teenagers to, why don't you take some of that energy to make the world a better place, instead of risking getting an infection yourself or giving it to someone else, why don't we do something to be helpful? One of my teenage patients called me and said, there's a whole lot of people who bought a lot of masks because of the North Bay fires to protect themselves from the smoke, and they still have those masks. How about if I start calling people I know and seeing if we can collect masks to send to UCSF? And wonderful idea, great concept, and that came from one of our teenagers. So I strongly encourage you to encourage your teens to turn their restlessness into positive energy and do pro-social things, and they'll be grateful for it. Now, quickly, so because I want to leave time for questions, we'll talk a little bit about coupling. A lot of people are living together as partners, and they're in small spaces that all of a sudden are way smaller, and they're tending to fight. I remember going to a wedding about a year ago where the priest told the newlyweds the 5 keys to a successful marriage: forgiveness, 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 and forgiveness. I'll add to that gratitude, 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 and gratitude. As a couple, start each day talking to one another about how the day is going to go. I know, for example, that my wife has a really important call that she needs to make today at 2:00. So you know what? That's a good time for me to be walking the dog. But look for ways, again, to be helpful, to be supportive of one another, to be encouraging of one another. Remind yourselves with gratitude every time you wash your hands. Give yourself that gratitude challenge for your partner, and cut each other slack. So let me stop there and just take questions.
Thank you. Thank you very much. That was really, really insightful. I appreciate that. Before I turn it over to Catherine, I do have a question myself that I'd love to get your thoughts on. My children are both under 10. And one of the things that is starting to come up, my son was like, lip was quivering and his eyes were tearing up last night as he said to me, "I feel like my whole life is now about ifs and maybes. If I get to go back to school, if I get to go to camp, maybe I'll get to have a play date next month." Like, when in the younger kids who are not necessarily fully rooted in the grasp of time, and certainly, really shaken up by all of the uncertainty, just as we all are, what guidance would you have for something like that?
Yeah, a great question. And I'm sure lots and lots of families are getting the exact same reaction from their kids. This is new ground for them. School's closed. They can't have play dates, and there's no end in sight. As a general principle, in talking to kids, by the way, talking to anybody, I like to validate what's valid and challenge what isn't. So I want to say, totally understandable that you feel that way because this happens so all of a sudden, and the health experts don't have a clear timetable on when it's all going to be over. And remember, we don't use but, we use and. Something I can reassure you with, it's not a matter of if, it's a matter of when. We are going to go back to school. Play dates will resume. Life will get back to normal. It's a matter of when. It may seem like a much longer time than it is because we don't know, but it's a when, not an if. And I'd answer it like that.
Great, thank you. When,
Yeah.
not if. Roger
Yeah.
that. Okay, I know there's so many questions. Catherine, do you have some questions you want to ask of Dr. Norman?
I do, yes, thank you. So how do you best deal with young adults now that they're forced back at home after college? So they've been taken away from their friends, and now they're living under mom and dad's roof with unfair rules while trying to keep us sane. So how do you deal with that kind of situation?
Great question. By the way, I remember when, gosh, it's 10 years ago now, that my wife and I dropped our youngest off at NYU and we high-fived, we had an empty nest. And then they started coming home. We have 4 children. They started coming home for a few months while they were getting settled. They came out of military service or they graduated and were looking for a job. So we sort of embraced the boomerang generation. This is a different situation, obviously, kids being forced home because of the pandemic. You know, what the best advice I can give is understand they're young adults, and that also means we can expect more of them. This is a pandemic. This is an emergency time. We certainly want our young adults to really respect the health rules. Social distancing is really important. We can see clear evidence in every country that's been, which is now every country on earth, afflicted in this, but countries that had it previously, China, South Korea, Italy, that social distancing works. We all have to do our part to participate in that. Washing our hands works. And so just remind them of their young adult responsibilities. And in fact, they shouldn't be leaving the house a lot to congregate. They shouldn't be congregating with their friends, and that we all have to respect that. So I would implore the young adults that, look, you want all of the perks of being a young adult. Let's see some of the responsibility. We're in this together, and you should be a leader here. By the way, remember Ariana was talking on Monday to someone about, who asked the question about what if my child doesn't listen to me, and she suggested, well, maybe they'll listen to Selena Gomez, see what celebrities are doing, and I think that's great advice. But I also think I just said about, and I also think it's really good advice to challenge your adult children to be leaders. Show your friends that you are responsible enough to maintain a social distancing, communicate with them by phone, by Instagram, by video chat, by all the ways in which you communicate. By the way, let's work on other ways of communicating, such as, draw pictures, write out a card. Before the internet, before telephones, people would sustain very intimate relationships with letter writing. Write a letter. It really works. But I would give that kind of advice. Expect them to step up and be leaders.
Great, thank you. I like the letter writing advice. I write letters with my grandmother because she doesn't email, and it's fun to get letters in the mail because it just doesn't happen very often anymore. It's a nice surprise.
Yes, and by the way, another very, very hopeful self-soothing regulation skill for teens and young adults is journal writing. Write about your deepest thoughts and feelings about the pandemic, about every adversity you have faced. Remind yourself of your own ability to be strong and to get through.
Great, so I think we have time for another question. With so much news and information available to kids, how do we balance the flow of information so they're not scared, while at the same time allowing them to learn so that they can empathize with the situation? Their 10-year-old daughter loves watching the news, and they just want them to be able to take some of it as to empathize, but how do you strike that balance?
Yeah. Well, again, as I said earlier, it's we do want kids to be informed, of course. We want to inform ourselves in terms of knowing what's going on and how we can best act. And we have to see ourselves as the number one most trusted source of the truth. That we, we as adults have to filter the news for our children, because an anecdote like a teenager dying from COVID-19 is going to loom way larger in their mind than the data that is overwhelmingly saying that young people tend not to get sick, and the illness is very mild. So so if they're watching the news, watch with them. Ask them, or if they watch the news and they saw something about you, ask them, what did you learn? What did you hear? What are your concerns? What are your worries? How do you feel about it? Listen, and then you see where their concern is. Then you can at least fact check and correct, because there's also a lot of fake news out there, and there's a lot of hyperbole, as well as, of course, good fundamental basic news.
Thank you. And I know we're almost out of time, but I have one more question, kind of riffs off of that about asking them questions. If a child doesn't want to talk about what's on their mind and their feelings, what is the best way to help them open up to have a conversation about it?
Well, I mean, one way. Thank you for asking. I had intended to mention this. Um, have younger children make a storybook, create a storybook. Let them draw pictures, and if they can write, they can write the storyline. Or if their writing skills are not there yet, they can ask you to write them. They can tell you the story. But sometimes, if it's one removed through a story, kids like to watch cartoons, animals, because it's one removed. Sort of dampens down the emotion when it's an animal or going through it. By the way, one last thing I think is really helpful. My wife and I raised 4 children. We could not have done it without Walt Disney. That, The Little Mermaid, my daughter must have watched 250 times. But those Disney kids like to watch things over and over again, because guess what? It's predictable. They know what's going to happen. They can master it. And almost all of the stories are about facing adversity. They're all derivatives of the hero's journey, where you go a long way from home, you face a lot of challenge, and you come back and everything works out. So I think they're inspiring movies, and they give the kids a sense of sameness and normalcy. So we don't want them to watch all day long, but watching a Disney video a day and parents sitting down with them, I think, is a good thing.
You talked about the importance of having routine.
Mm-hmm.
What about the weekends? Should we keep the same routines on the weekends? Maybe not study, but how do routines work on the weekends?
Yeah, I think try to have a weekend schedule. Now, of course, what we can't do is we can't congregate. We can't go and have play dates. We can't join our soccer teams or basketball or volleyball teams. So we can't do those routines, but families can still do family routines. If they were accustomed to a soccer game on a Saturday morning, they can go for a walk on a Saturday morning, or do some other kind of play activity. It's enough that kids are losing the routine of being able to hang out with friends, but that doesn't mean they have to lose something they're looking forward to. Usually parents are involved with those activities. Parents get together for play dates when their kids are playing. Parents are there on the sidelines when the kids are playing soccer. Do something together as a family, as you would on any Saturday. And if you were normally going for a hike on a Sunday with your family, do that. Now, we got to be careful. Some of the hiking trails are getting pretty crowded, so we want to make sure you absolutely maintain the appropriate social distance, but plan those activities. Watching Netflix together.
Thank you. And then we have some other questions around teenagers.
Mm-hmm.
One of them is, do you have any advice for coping mechanisms for teens? And I don't think this just applies to teens, it could be anybody who are dealing with depression and anxiety anyways, and now it's just been enhanced with the situation.
Yes. Yes. And by the way, this is a situation that's anxiety inducing for anybody. If people were prone to anxiety, it could make it worse. Although I must say, my patients with OCD, with obsessive compulsive disorder, who compulsively, excessively wash their hands, are all telling me, "I told you so," and they say, "Not who's the crazy one, doc." But seriously, indeed, anxiety can get worse. So every emotion is rooted in the word motion. Actually, it's where it comes from. The Greek word for motion is at its root. So when we have an emotion, it's a warning bell that compels us to act. So if I'm walking across the street and a taxi cab is coming at me at a high rate of speed, I feel afraid and I run. That's appropriate. Emotions make us want to do something, anxiety in particular. So give kids something to do. They can write cards to grandparents. They can call neighbors and ask if they're short on supplies. They can give them tasks to do, and that's the best way to handle anxiety. Depression. Anxiety can wear the brain down and people can get depressed. One of the models we have for depression is that is of understanding depression is called learned helplessness. That if you're in a situation where there's nothing you can do, the helplessness overwhelms and you're just shut down. And one of the things a pandemic like this does is it makes us feel helpless. So we got to remind ourselves that we're not helpless, that we can wash our hands, we can keep a social distance, we can be there for, family and neighbors, keeping a social distance, of course. Um, and what else can we focus on? What else can we be doing to make to bring out our best selves? Maybe this is a chance. Mark Benioff mentioned yesterday on a all hands meeting. This is a time to become rangers in Trailhead. This is a time to pick up and learn the guitar like you've been promising yourself, or write letters, have a greater depth of communication. Another way of understanding depression too is to just ask how you're feeling about you. Is the child blaming themselves? Do they feel that they're not a good kid, that somehow this is something they've brought on, and reassure them as to the reality of that. Physical activity also helps a lot with depression as well as with anxiety. So encouraging, exercise routine. And then indeed, if you have a child who has been in therapy, um, video chats work very well in therapy. If we have a good quality video chat connection, people, both patients and doctors, therapists feel equally good as in person. Actually, I got to tell you, my patients like video chats. They say that I have a tendency in my office to kind of look out the window and daydream a little bit. They hope I'm thinking about them. But in the video chat, I'm forced to look at their face. They also say they like the sense of collaboration. It feels equal. It's literally face to face, not me, the doctor, them, the patient. And interestingly, we've known this for a long time, but with technology, people are more open. People are willing to be more vulnerable. We see that with online dating. People are willing to be vulnerable and say, I'm lonely, I'm looking for a soulmate. At the party, the wall of indifference goes up and people are cool and not, all of that. But kids in particular, they're often willing to tell you things on a video chat that they didn't in your office. And so all of those things can be ways of still
So
helping kids or
I want
something.
to I want to dovetail on that. Sorry to interrupt,
Mhm.
Catherine, but when you were talking about anxiety, I think there was another really interesting question that came in on the chat screen here.
Mhm.
Does your advice differ if someone has had like routine exposure? So the question and the thing here said, in Australia, we had bushfires, we had storms, we had smoke, and now COVID-19. And my son refers to himself as now having anxiety. So he's
Mhm.
nearly 13. Do you have
Mhm.
any thoughts on how to deal with the cumulative effect? Like, does your guidance change in a situation like what our
Well,
parents
yes,
and
I
our
mean,
Ohana are dealing with in Australia? It's so much.
yeah, absolutely. And by the way, this was something I was thinking of addressing too in our next talk next week. But when we go through a trauma, it reawakens earlier traumas. You'll have flashbacks, nightmares, awarenesses of other traumas you've been through. Um, the really challenging part is sometimes those traumatic memories are very painful, very difficult, and overwhelming. A positive, a silver lining in it is you can then ask yourself, how did I get through that? How do I manage that? What would I have done differently back then? Maybe I can do that now. But if we can remind ourselves with those period of those series of traumas that we were resilient, we got through them, we survived individually, as a family, as a community. So we encourage kids to think about it that way. This gets well. We know that if you're fortunate in life and then something bad happens, you have a trauma like you're in the pandemic or there's a fire or a flood, but before then things have been what we call average, expectable, normal life. We know it's hard to get through, but people are resilient. If you grew up in a household where there's domestic violence, where there's physical or sexual or emotional abuse, you're in a war zone, you're a refugee where the trauma is daily. We actually have a diagnosis called complex trauma because the effect of repeated trauma on the developing brain absolutely affects your brain chemistry, your ability to regulate emotion. It also affects your sense of self worth. your ability to trust, and you can get triggered and emotionally dysregulate. No, I'm not saying that that particular child is going through all of that, but he may be questioning what is this is what life is, the one trauma to another, and starting to feel a little bit worn down by the lack of control. So we'd want to help him really feel more positive about the resiliency aspect, remind him of how much strength he actually has, and again, really help him focus on what can you control. That's just a very broad stroke overview.
Thank you. Thank you. This has been very, very helpful. Very helpful. Thank you so much
My great
for
pleasure.
the very big and serious gift of your time. That is
Well,
amazing.
I was saying to Catherine before we started, and Jody, this is up to all of you, but I'm very willing at other times to do an hour-long Q&A with people, anybody who wants to come on and ask questions or set those up, that happy to help in any
All
way.
right. Well, that's wonderful. That's wonderful. And we'll, everyone should know that Dr. Norman is going to join us again next week. We'll talk about a different topic, but I'm really looking forward to just continuing to learn from you through this period and beyond. So thank you. Thank you very much. And we'll see everyone on the call tomorrow. Bye-bye.
Bye-bye.